Well, the simple answer is no. Really, anything, any organ in your chest or really in close proximity to your chest can cause chest pain. Understandably, most patients or most people, when they get chest pain, they will be a bit more worried about the heart, because for them, it's probably the most important organ really there. But with literally every organ in the human body is quite important. Most organs where they are, as I said, close to your chest can give you chest pain, even really starting from your neck, the muscles, the bones, the nerves around it, all the way down to your gallbladder or your large bowels or the colon, because part of it will come close to the chest. All these organs will give you chest pain. And really, that's why when we teach medical students, even when we see patients, we don't just simply hear there's chest pain. We ask so many questions. I mean, sometimes from the first or second question, you will get an idea about what's going on. But sometimes you have to ask so many questions. You ask about the patients in general, regards to chest pain, to think what's patient, for example, this kind of patient will have chest pain. For example, if you get a young man or woman who's 20 years old, you know that it's quite less likely to have chest pain coming from the heart, for example, and you start to think about other causes. At the end of the consultation, usually by these questions, most likely you will have an idea about what's caused the chest pain. Sometimes you have to do extra tests to make sure. Sometimes you do tests to rule things out or rule them in. And really, that's why clinical examination, so many questions, ask about the patient themselves, is very important to tell where the chest pain is coming from. But the simple answer to your question is not the heart, really. In fact, we do have heart-related chest pain clinic in every hospital, really, in the country, in every hospital probably in the world. They do run such clinics. And most of them, really, you find that the patients whose chest pain is heart-related is probably about only 10 to 20% of the total patients we've seen. The chest pain is heart-related. It's a simple answer. Again, I'm going to ruin it. It's yes. And it's getting more and more, probably in the last 2 years with COVID and COVID-related issues and lockdown. Most people had a degree of anxiety and stress about our own health, and anxiety and stress can cause any kind of symptoms in your body, really. It doesn't only cause chest pain. Many patients will have palpitations, headaches, abdominal pains, dizziness, even symptoms you think it must have been like organic. And it's proper real symptoms. Chest pain is one of the very frequent symptoms patients with anxiety do get. And I have to say, this chest pain can be even more painful, of like the pain itself is probably more severe than patients who do have angina or who do have like organic chest pain related issues. And it's difficult because, you know, when I said we asked them so many questions about how the chest pain feel like and the nature of the chest pain, anxiety-related chest pain usually doesn't fit in any of these categories when we're looking for organic-related chest pains issues. And it's usually diagnosis of ruling out other things. I have to say, many patients will be aware that they are anxious, they are stressed. Loads of patients do not know, actually. They do not even know that they are stressed. In hindsight, when you see them like in your follow-up appointment or sometimes a year later, they'll tell you, oh, doctor, you know what? I was really stressed. But the main thing really for these patients, most patients I find, even like, you know, even from not patients, sometimes friends and families and people who do get chest pain, and they don't like the answer is stress related. We don't like it. And whenever we think it's anxiety related or stress related, we confirm that by doing tests to make sure that it's not really related to organs. The most important thing, these patients do have concerns. Some patients have concerns about, is it coming from my stomach, for example? Is it coming from my heart? Is it coming from my lungs? And we have to address their concerns, whether it's heart related, then we do some heart tests, at least to address their concerns. Most of the time, we know that the test will probably come back normal, but it's important to do the test sometimes to tell the patient that your tests are normal, other tests are normal. It's probably something related to stress. Sometimes we leave it blank, really, to leave it to the patient, and then we just reassure them for meanwhile and then review them later. The good thing about stress or anxiety-related chest pain is that it does settle with time. Now, time can be variable. And the other thing, it doesn't have long-term consequences. The long-term consequences of the pain itself is exactly the long-term consequences of what the stress can bring to their really daily life. Not directly. So COVID-19, it just usually is like any other viral infection. Many patients do have COVID-19 and they don't even have any symptoms at all. Most patients get a bit of tiredness, temperature. Is a patient who get chest pain related to COVID-19, if they have persistent cough, if they've just been coughing for days and days, they'll end up having some chest pain simply because of stretching of all the muscles around your rib cage, and then coughing will become very sensitive. So if patients have COVID-19 and they cough in, and the cough gives them pain, that kind of momentary pain, then it's usually related to cough. In very few occasions, and I don't really mean to scare patients, scare people here, but occasionally COVID can be so bad and it can cause consequences, mainly vascular, mainly something related to the vessels, by causing clots. And that clots can potentially cause heart attack or a clot in the lung. And that chest pain is related to COVID. It's not frequent, it's not common, but it's pain. The patients usually will be able to tell that this pain needs to be seen. Most patients will eventually, or really when they get this bad pain, will seek help, and hopefully they will not be missed out sitting at home. Patients who get chest pain related to cough, they will be able to tell that this chest pain is coming really when I'm coughing only, and usually just related to the chest infection they have at the time, and it will settle once the cough settled. But if in doubt, I advise everybody to really seek help, to see a doctor. All types of chest pains are serious. It doesn't have to be serious because it can have medical or health related consequences. It can be serious enough just because your mind is so, like, worried about it or concerned about it. People generally tolerate headaches much more than they tolerate chest pain, tolerate abdominal pain more than tolerate chest pain. And remember, the chest has got so many vital organs. You've got the heart, you've got major vessels, you've got lungs. So any kind of chest pain can be potentially serious. You eventually find that 90% of them, after investigation, after talking to your doctor, are not really serious. But to start with, any chest pain is serious, simply because it's pain. No one likes to have pain. At least you will need painkillers. The ones which is really serious, and probably when we ask the question is it serious enough? Do I need to get help right now, or can it wait? And there's few symptoms and signs can tell the patient whether I really need to get help now or not. And to make it in simple way, any chest pain which you never had before, you're not familiar with, and the pain is so bad, lasting more than 10-15 minutes, you've got really to seek immediate help. And I would advise these patients to avoid calling GPs, because GPs do not have really the luxury of doing tests and ECGs. And, it's not ideal to see GP for that reason. You better call NHS Direct or call 999, and we'll take it from there. If in doubt, somebody can take you to A&E and you're close to A&E, just get it checked if it's so bad. If the chest pain happening associated with feeling breathless with that pain, then you need to seek immediate help. If the pain is going elsewhere, like going to your jaw, going to your left arm, lasting more than 15 minutes constantly, or you're feeling really unwell with the chest pain, this is likely to be serious, or at least the seriousness of it needs to be ruled out. And that ideally should be done in a hospital. If the chest pain with some other symptoms like vomiting, sweating a lot. And the most important thing, if the chest pain you're not familiar with, you got loads of patients who they know that, for example, I moved my neck wrong movement yesterday in the gym, and now every time I move my shoulder, it hurts. We know this is probably from the gym yesterday. This muscular pain is probably not that serious. If you're familiar with your indigestion, like for example, a night after a heavy meal, probably a couple of pints, and you got that chest pain, and it's indigestion, it happens to you like once every few weeks, and you probably it's indigestion, then you don't probably need to do that. But my advice, if anybody is concerned about their chest pain, and the chest pain took long enough, then it's serious or potentially serious, you need to seek medical help. If the chest pain happened just once for a few minutes and disappeared and not been recurrent, then it can wait to see somebody later, see probably your GP next day, or and get advised about it.